Using augmented reality in the treatment of phobias. Our team wants to design an augmented reality application for Hololens that is aimed at helping individuals suffering from a specific phobia conquering their fears and be able to interact with their phobia in their daily lives after treatment. So what exactly is a phobia? A phobia is a type of anxiety disorder where a person may have an excessive or unnecessary fear in the presence or anticipation of a specific object, place, or situation. Symptoms can include sweating, a sense of choking, increase in heart rate, among many other symptoms. Every patient reacts differently to their stimulus. Phobias are more common than you think. About 19 million Americans have phobias. That's around 8.7% of the U.S. population. Women are twice as likely to develop a phobia than men, and most phobias begin in early childhood around the age of 7. 15 to 20% of us have a specific phobia, and only 20% of that actually recover. Now, what is exposure therapy and how does it help? Exposure therapy is a treatment used to treat phobias by gradually exposing the patient to their fears in a safe environment. This is repeated several times until the object or situation becomes acceptable to the patient. Graded exposure therapy starts the user off with mild exposure and works patient up to more difficult exposures. Systematic desensitization is a therapy technique that pairs exposures with relaxation exercises until the patient associates the fear with relaxation. Exposure therapy helps by presenting the fear in the patient's current environment. It can decrease the previously learned association between the fear and anxiety. The patient is convinced that they have the ability to overcome their fear, and the patient can learn to process their fear in a less severe manner. This is what the user will see through Microsoft's Hololens. In the main menu, the user can choose their phobia from the list. A secondary menu will appear where the user can choose the type of their phobia. Like in this example, the user can choose either a friendly garter snake or a king cobra. Next is the stimuli controls. This is where the user can control the stimulus. They can decide how many stimuli, whether it's contained, size of the stimuli, speed or movement of the stimuli, and the distance from the user. Now we'll explain the second touch point for the user. This app is a tool that allows the user to keep up to date on their progress out of the psychologist's office. They are given a calendar to view upcoming and past appointments. From the screen, users can view the data and progress made in their appointments. The graph records their anxiety levels throughout the appointment. The psychologist can add notes or comments so the user knows what to continue doing or improve on outside the office. These graphs track the patient's improvements from the first treatment to the most recent, so the user can view their overall progress. When testing our second touchpoint, our goal was to understand how tracking a patient's data can increase their motivations and enhance the overall treatment of phobias. We created an interactive prototype using Envision in order for users to realistically interact how they would with a normal phone application. The same users that tested our first touchpoint were also asked to participate in this test as well. In their tasks, they were asked to find certain data, such as when is your next treatment taking place? What was your average level of anxiety for your last treatment? Or how has your anxiety level increased or decreased over the course of the entire treatment?